Today we'll be looking at something that's very integral to sexual and reproductive health and something that has been a cause of worry to so many. We want to talk about infertility. Let's dive deep into the world of infertility and see what it is and what it is not. Most times, men tend to make infertility, or people tend to make infertility look like a woman thing. So let's just say this once and for all. Can a man be infertile?
Yes, men to contribute to infertility. So the causes of infertility, when we are talking about the men, we have defective spermatogenesis. When you say spermatogenesis is the formation or the production of sperm. So when during this process now, maybe the sperm that is being produced are not how it's supposed to be. A normal sperm is supposed to have the head, the body, and the tail. So when the sperms are looking like maybe a peanut or whatever, then we know that sperm is actually defective. Or we also talk about recurrent infection, that is in men. So having gonorrhea, syphilis, and when he notices that he's having painful urination or itching, instead of him to go to the hospital for proper treatment, he prefers to patronize the chemist to get, he knows Augmentin, he knows all those antibiotics, so he takes them. And yes, they will relieve the symptoms a little bit, but there is accumulation.
It's quite essential. Okay, so let's look at the female, the lady. So what could be possible causes for the female?
Okay, we have, they're a little bit broad. Okay, we have ovarian factor. And we also have PCOS, that is polycystic ovarian syndrome. Guy, that stuff is...
So let's just look at the role that... Is there any role that age plays when it comes to infertility?
A lot.
Okay.
We here in, should I say, our society, we be like, okay, women, you have to get married before you're 25, so that you could give birth early and all of that. And the men will be like, man, make money first, so before I go touch any woman.
Yeah, money is important too. Money is important.
Before I get married. So it affects both male and female. So for the females, from 35 years, the egg, the quality and the quantity of the egg are being declined. And also for the males, from 40 years, it's being declined.
Why did you shout? Why did you shout that?
Go and marry.
Okay.
Yeah, I was about asking.
Let's also talk about lifestyle features. Lifestyle features. Let's say there's no age. Is there anything that somebody would do? Is there a kind of life you may put up that may predispose you
to infertility?
Yeah, to infertility.
Yes, a whole lot. Papa Emeka lifestyle, dressing. Yeah, Papa Emeka. That's what I'm looking at you. Papa Emeka, he wears tight play pants, tight boxers, and tight jeans with even trousers. So when he does this, he is cooking the balls.
Okay.
Yeah, the heat, smoking, and obesity. So I've been screaming online that people should be going for workout, and they feel that it's not necessary, Joe. That it's person that eats. That's what.
Okay, because some people feel. I think that's essential, because some people feel that they say I'm not fat. How can somebody preserve their fertility? What are like the treatment options for infertility for someone who is like infertile? Or what are the possibility? What are the possible ways the person have when it comes to infertility?
Okay, if a person is infertile, maybe you went to the hospital and they died from the diagnosis. Well, that's not the end of the road.
Hello, it's another episode of the Intimate Matters podcast. And just like always, this podcast starts with taking on a deep dive into the world of sexual and reproductive health. And we teach you all you need to know about sexual and reproductive health. I'm your uncle, Nurse Akwa Walkman, and today I have with me a very versatile personality in the person of Deborah Eka. Please say hello.
Hello.
I told her to say hello. She just said hello. It's all right. So today we'll be looking at something that's very integral to sexual and reproductive health and something that has been a cause of worry to so many. We want to talk about infertility. Let's dive deep into the world of infertility and see what it is and what it is not. So Deborah, what is infertility? How do you explain infertility to someone out there?
Okay, thank you so much. Infertility is a medical condition. and it arises when a couple is unable to achieve conception after having regular unprotected sex. So that regular unprotected sex is being circled for at least 12 calendar months. That is a year. And when I say regular, I don't mean once in 2 months or once in 3 months. I mean at least 3 times a week.
Okay. So you're trying to say that for someone to say he or she's infertile, has to be that you're having sex, you're doing regularly, and there's no protection, by the way, and you're willing and you're wanting pregnancy or conception, and then it's not forthcoming.
Yeah.
And you have to do it over the span of like
1 year.
1 year. That's 12 months. So it means that if you're doing the do and if you're trying and it's like 1 year and you're not having, then that means that is infertility. I'm one person that, is very social media savvy. I go around a lot on social media, and I see that most times men tend to make infertility, or people tend to make infertility look like a woman thing. So let's just say this once and for all. Can a man be infertile?
Yes.
Okay. So let's talk about the causes. Start with the man. So what could cause a man to be infertile?
Okay, in our society, let's say Mama Emeka has been known to be barren, let's say barren. And everyone just thinks it is Mama Emeka. The husband, Papa Emeka, has nothing to do with being infertile. But if you want to look at it from the medical aspect, which is actually true, men to contribute to infertility. So the causes of infertility, when we are talking about the men, we have defective spermatogenesis. When you say spermatogenesis is the formation or the production of sperm. So when during this process now, maybe the sperm that is being produced are not how it's supposed to be. A normal sperm is supposed to have the head, the body, and the tail. So when the sperms are looking like maybe a peanut or whatever, then we know that sperm is actually defective. Or if the sperms are just dead or not active as it's supposed to, then that's a problem. Then we also talk about recurrent infection. That is in men. So having gonorrhea, syphilis, and when he noticed that he's having painful urination or itching, instead of him to go to the hospital for proper treatment, he prefers to patronize the chemist to get, he knows augmentin, he knows all those antibiotics. So he takes them. And yes, they will relieve the symptoms a little bit, but there is accumulation. And when this accumulation occurs, it leads to what they call the blockage of the vas deferens. So now this vas deferens is a tube that helps to convey the sperm from the testicles.
Okay. So when we're looking at, so you're trying to say that the causes could be on the aspect of the sperm themselves, like if the sperm are not made the way they're supposed to be, or maybe they are not made in the quantity or quality that's supposed to be. Then also when there is issue with transportation. So let's say the sperm is made in the testes, but like you said, you mentioned the vas deferens, it's blocked and the sperm cannot come to the outside. So Papa Emeka, borrowing from her, I'm not calling Emeka. Papa Emeka, it's essential that you know that you can also be an issue when it comes to this infertility. So let's look at Mama Emeka. What could be the causes when it comes to Mama Emeka?
Oh, are we going to come back to the male?
Okay. You still have more to say?
Yes,
okay.
Exactly.
All right.
Yes. The next thing is
and please don't attack my gender. Continue.
Mumps. Okay, mumps is a viral infection that occurs in children below 5 years, and it affects the salivary gland, that's the parotid. So now you could ask me, or maybe watching me, you say, how does the salivary gland has to do with the male reproductive organ? Now we have the testis region. If the salivary gland is being infected, then the testes will also be infected because they are both lymphoid tissues. Now, there is this medication this vaccine that is being given after a child is born. After 1 month, the mom's vaccine is being given. So if a child wasn't given the vaccine and the child had mumps, from there, the child remains on steroid till death.
Oh, well, so that's to say that if lack of vaccination against mumps and then the person gets to have the mumps infection, it could affect the testicles since since the tissue that the mom's affecting in the salivary gland is the same
They are
as
the
what
same,
makes up the
yes.
testicle. Oh wow! So I think that points to show how essential it is to get your children vaccinated. As I'm living here, I'm going home, talking to my people and asking them to bring out my vaccination card because I need to tick off some things. It's quite essential. Okay, so let's look at the female, the lady. So what could be possible causes for the female?
Okay, we have they're a little bit broad. Okay, we have ovarian factor.
Okay.
So when you talk about ovarian factor, we know ovulation, just like the releasing of the eggs. So let me start from hormones. When there is irregularity in the hormones that helps in ovulation and fertility. So that is a factor. Because if the eggs are not being released, then how would the sperm
come to fertilize?
And we also have PCOS, that is polycystic
ovarian syndrome.
Guy, that stuff is
I think it's getting, I don't know, but it's like people are getting more aware of it. A whole lot of people are reporting and having the syndrome now.
I was in the gynae clinic for 2 days, and within the 2 days we had 5 ladies who came for it. Like they didn't just know when they came, they did the diagnosis and they got to know that it is PCOS. So you see, you need to get yourself tested, or like you need to go for proper checkup so you could know. So that is one of the cause. Why? Because this polycystic, a woman is supposed to have those more of those female hormones, but the male hormones are more, and this affects the release of the eggs and all of that.
Okay, so in polycystic ovarian syndrome, a woman is manifesting more of the male hormone, the androgen, thereby impeding what the female hormone should do. So sometimes we see the woman, they will say she has some masculine features.
Yeah.
What do you call it? BA?
Yeah, they have distribution of hairs like the males.
Okay.
In the BAs and down.
Oh, all right. So apart from PCOS, are there any other causes that we're supposed to know when it comes to women? Because I also know that sometimes away from the ovulation and the rest, there could be issues actually to the organs of reproduction.
I'm coming.
All right.
Okay, we have the next factor is tubal factor.
Okay.
So when I say tubal, just as we said for the males, the vas deferens, but here we are talking about the fallopian tubes. So in this case, the fallopian tubes are being blocked. You ask how? Okay, let's say, let me not use Mama Emeka again. I'll turn it to Bridget.
Okay.
So Bridget has gonorrhea. She has syphilis. Yes, and just like Papa
Emeka of the whole story.
Yes, went to get augmentin and all of that, and she didn't treat herself well. So it accumulates and kind of block the tubes. And when the tubes are blocked, if you look at the female reproductive organ, if you look at maybe through a textbook, we get to see that the fallopian tube, there is what you call an ampulla, and that ampulla holds the egg.
Okay.
So if the tubes are blocked, then how
can the egg come and
come to meet the sperm for fertilization to occur? We have two types of fertility. Infertility. Okay. So primary, it's when the couple, none of the partners have achieved conception. That is, the man has not got anyone pregnant before, and the woman
has never gotten pregnant.
And then for secondary, the man has gotten, and the woman too has gotten someone impregnated before. But on subsequent time, they can't achieve conception.
So that means if you feel blow today, you know blow tomorrow.
If you know blow tomorrow.
Okay.
So in that case now, the maybe when she had her first baby, you have given birth in the TBA, that's the traditional birth attendant, and the instruments used for delivery, the scissors and did they use forceps there? I'm not sure those guys use forceps, but whatever was being used for delivery wasn't sterile, and so that gave the human infection. So that infection too, we call it puerperal sepsis, can lead to blockage of the tubes.
Oh wow. So we're looking at the fact that it's important we note this, because as someone who is out there, I've had people approach me and they say, okay, let me share this story, because a lady reached out to me and asked me that something is wrong with her. I was like, what's wrong? She said she's been trying to get pregnant, but she's unable. Now, funny enough, not judging because it's her life. This was somebody who is not in a committed relationship.
Okay.
But she just wanted to get pregnant to prove to herself that she's fertile. So I asked her and was like, why are you worried about yourself? What if it's your man? She was like, no. My man got someone pregnant when he was in high school, when he was in secondary school. So he already has a child. It should be me. Not forgetting, right? Not knowing, like you said, that there's secondary infertility.
Yeah.
You can be fertile today and not fertile tomorrow. That's okay. So let's just look at the role that is there any role that age plays when it comes to infertility?
A lot.
Okay.
We here in, should I say, our society, we be like, okay, women, you have to get married before you're 25, so you could give birth early and all of that. And the men will be like, man, make money first, so before I go touch any woman.
Yeah, money is important. Money is important.
Before I get married. So it affects both male and female. So for the females, from 35 years, the egg, the quality and the quantity of the egg are being declined. And also for the males, from 40 years, it's being declined.
Why did you shout? Why did you shout that?
Go and marry.
Okay.
It's been, the quantity and the quality have been reduced. You can have like low sperm counts and all of that.
Okay, so you're saying that for at 35 for women and 40 for men, a depreciation starts to come into the quantity and the quality of their sexual gamete. So as you've heard, 35 when you're approaching, make plans for that. So it shows the role that, because thank you so much for pointing that out. Even though I'm a man, I know that people like me always feel that they're immune to this stuff. And I think we'll also go there because most of them quote their great grandfathers and the rest.
Yeah, I was about asking.
Let's also talk about lifestyle features. Lifestyle features. Let's say there's no age. Is there anything that somebody would do? Is there a kind of life you may put up that may predispose you
to infertility?
Yeah, to infertility.
Yes, a whole lot. Should I use Papa Emeka again? Papa Emeka lifestyle, dressing. Yeah, Papa Emeka. That's what I'm looking at you. Papa Emeka, he wears tight play pants, tight boxers, and tight jeans with even trousers. So when he does this, he's cooking the balls.
Okay.
Yeah, the heat. That's why you know that. Notice at some points the penis, it's now reduced in size because of the too much heat, and also putting of phones in your front pocket and kind of
the radiation.
Yeah, the radiation
will
affect the sperm quality and all of that. Also, alcohols, smoking, and obesity. So I've been screaming online that people should be going for workout, and they feel that it's not necessary, Joe. That it's person that eats. That's what.
Okay, because some people feel. I think that's essential because some people feel that they say I'm not fat. Yeah, that's how they put it, not knowing that they may be tilting towards obesity based on their body mass index. So my gender out there, you're being asked that you know how you dress, try as much as you can not to cook your balls. You can wear something tight to keep your instrument in place while outside, but once you are away, please free it so that balls will not cook. But don't just so don't women have lifestyle issues? Is there nothing they can do that will predispose them?
Okay, still the smoking, because still have women that smoke and drink, even obesity.
All right.
Yeah, it affects. You know, this stuff has to interfere with the hormones that helps in ovulation and fertility. You're trying to tell them, what you're doing, you don't know what you're doing. Let me help you. So.
Oh, all right. So foodie gang, be careful so you don't get obese. And I just want to add this that also weight loss gang, sometimes you might be underweight, and when you are underweight, it's essential to know that as a lady, the fat in your body also helps to synthesize certain hormone that is very important for your reproduction. So while you're trying to reduce weight, don't get underweight because you may also be impeding something. So let's look at diagnosis, because like you said, I don't think it's appropriate for me to just sit down in my house and feel I'm infertile. So what is needed? How is infertility diagnosed? I'm talking about clinically. How can they say Akwawo is infertile, but not this Akwawo?
Okay, for the diagnosis of infertility, most persons say that prefer to go to the should I say diviners or babalawos and all of that before they go to the hospital. If they are most couples, if they notice that they are not achieving conception, but it's best to go to the hospital for this diagnosis. So the first one is hysterosalpinography. So this is just the X-ray of the uterus, the tubes.
Okay.
So know how they are. So we know. Okay, we know where we start our prayer points from.
All right.
Yeah, and we have hormonal profile. So when I was at the clinic, I think I saw them making a hormonal profile for a client. So this hormonal profile has to do with tracking of the follicles.
Okay, and tracking the hormones to see if they're at the right level. Okay.
Not only that, we also have ultrasounds and sperm analysis. That is examination of the sperm.
Okay.
To see if the sperm is looking how it's supposed to look. Just as I said earlier, it's not looking like peanuts. And to check if the sperm is active. Yeah, you produce the sperm, but
active. Okay, so you talk about semen analysis. I don't know what your issue with peanut. I love peanut to ensure that your sperm is the right shape, not like peanut. So they do semen analysis and to also ensure that it's active and it's running around like we should run around. So is there any misconception when it comes to diagnosis? Is there something people do that they think can help them know that they're infertile, but it's not actually like the truth? Because I know a whole lot of people self-diagnose themselves. You just ask somebody and he says, I'm infertile, without any prior doing anything.
Maybe those ones, they go to the church or the spiritual leaders or Babalawo, just as I said, yeah. But for misconceptions about infertility, most people feel that it's painful.
Okay.
Like as they are going to examine you, it's going to be so painful. But the truth is, it's not painful.
Okay.
Yeah, I don't think X-ray, apart from the radiation, which is being controlled, I don't think it's going to pierce through your souls.
Okay.
And then most people talk about it's too expensive. Yeah, I know it may be expensive a bit, but it's not as
expensive as they
imagine. And then some men too feel that is for the women.
That one, yeah, that's very, very true. Because most times, like you said, being in the clinical space, you realize that it's more women than men.
We have to say the next visit, when you're coming for your next visit, please come with your husband. And she said that she have tried speaking to the husband, but the husband is not. So we have to devise means to pull the husband to it's hard. Please also check yourself.
Okay, so the check yourself is mainly for the men. So I know this might be bulky because, like you said, there are so many aspects of infertility, but just common ones and ones that come to mind. What are like the treatment options for infertility for someone who is like infertile? Or what are the possible ways the person have when it comes to infertility? Okay,
if a person is infertile, maybe you went to the hospital and they died from the diagnosis. Well, that's not the end of the road. Just like HIV, I know there's no cure, but there's something given to you to still stay alive. So for infertility, there are medications being given. So for men, it says sperm boosters, and even women, the hormones, they are being injected to help with the regulation, so they could have their ovulation and
possible conception.
And not only that, if after the medication and it's not working, then we go into IVF.
Okay.
That is in vitro fertilization. Try IVF. And if IVF is not working, to surrogacy, give somebody a guy for you. And you could adopt or foster a child.
Oh, all right. So they've talked about from getting medication to help with whatever was the cause of the infertility, to replacing hormones as need may be, then trying assisted reproduction technology like IVF, then surrogacy. Because I think that reminds me, and as we're progressing, we're going to have an episode on surrogacy. We're going to have episodes on fertility assisted reproduction, because it's quite essential and it's something that is really coming up. And I think that with this and even adoption, you can say to be able to treat yourself of infertility. So let's look at something that has been really much, not talked about much when it comes to infertility. Because sometimes when infertility is being spoken about, people look at it from the physical perspective. Like you said, you talk about pain. What of the emotional impact? So how does it affect, how can it be managed, the emotional impact to infertility?
Okay, I think as Nigerians, I think Nigerians will also view this. As Nigerians, while growing up now, we watch more or view more of the Nollywood series. And there is no how you will not tell me that out of 1 to 10, you've not seen movies that there is infertility issues. Yes, from the movies there, you see that the woman is always sad. I think the husband, most times, if the husband cares, but the atmosphere, the woman is always sad. She's always withdrawn. She feels guilty. And this grief, there is no happiness at all. So that is the emotional impact on the couple.
Okay.
Yeah.
Okay. So infertility brings a grieving, brings sadness, and especially on the part of the woman, unfortunately, because I believe that it shouldn't be so. Since conception is, it takes two to tango.
Takes two to tango, yeah.
So when it happens like this, so what are certain intervention for them? We're talking about, maybe you could look at it from the aspect of non-clinical space, like when we're talking about their family or their loved ones, what could they do for them? And also, what can the people in the clinical space, doctor, nurses, the scientists that are trying to diagnose this, what can they do for them to, to take care of this emotional impact?
Okay, we encourage them to join support groups. So when you say support groups, I think even on Facebook, on the social media space, Facebook, WhatsApp, and even Telegram, there are groups. I know of one trying to conceive moms, or trying to conceive couples. So they could join the support groups. When they join the support group, they'll see people with the same condition. So they'll feel,
I'm not alone.
Yeah, I'm not alone. There are persons. And those people will also share their testimonies. From their testimonies, they get to learn. So the healthcare professionals are to encourage, even the friends and loved ones, they are to encourage the couples to join the support group. Not only that, I think the healthcare, the friends and the families, they should try not to judge them.
Okay.
Maybe it could be the causes of the infertility. Maybe during abortion it happened and all of that. They try not to judge them, but they should just keep supporting and encouraging them lovingly.
That's very true, because sometimes, especially when the cause is from the person, people tend to be a little bit more judgmental. And you talked about abortion, and we'll look at things like, because I think that something has become very prevalent. We're looking at rhesus incompatibility. When the cause of abortion for a woman who was rhesus negative got pregnant with somebody rhesus positive, and because of that, there's sensitization during the course of the abortion, and then subsequent babies cannot stay in the womb. So it's also important to realize, because I think some people don't even realize that to a certain extent, even before doing abortion, whatever could be the reason, or a miscarriage, whatsoever could be the reason, that your body has already set itself into the pregnancy mode. And some of the side effects can still come to haunt you. Okay, so let's look at preservation, fertility preservation. How can somebody preserve their fertility?
Okay. When you say preservation of fertility or fertility preservation, I would like to go to the meaning first so I could calm down. So, fertility preservation is actually the freezing of the eggs, the sperms, and the embryos for future use.
Okay.
So now, this is being done, should I say, into 3 parts. So the first is cryopreservation, and the second is ovarian stimulation, and the third is medical evaluation. When you talk about cryopreservation, it's just as I said earlier, the definition is still the freezing of the eggs, the sperm, and the embryos for future use. And then the ovarian stimulation. This is there's now introduction of medications to stimulate the ovaries to produce more eggs. And then medical evaluation. That is just a comprehensive assessment of the patient.
Okay.
So those are the 3 parts that
you can use to preserve your fertility.
Yeah.
So that means if you go there and you're evaluated from every aspect, I want to say head to toe, but head to toe does not involve. So if you're evaluated from every aspect, they can get to know what's wrong with you and tell you what to do. And sometimes the ovaries may need to be stimulated to produce more eggs. And then sometimes if you realize, I think it's something that people should get to know, especially now, like you said, for the men, because maybe you want to settle down and make a certain level of cash before you get there. You can give out your sperm to a bank and they can hold it for you. They'll hold it in ice. It will stay long. Same with the women. Give out your egg and they keep it for you. And we're seeing a whole lot of that in the Western world where people come to get married at 40, 50, bring their eggs that preserve since in their 20s, and they use that to, get fertile and to have their child. So that is when it comes to preserving your fertility. And I want to say that, like you usually said, men, it's important that you put your hat on when it comes to infertility. Scientific studies shows that the crux or the brunt of infertility falls at the same portion between the man and the woman, 30% to the man, 30% to the woman, while the 40% is still the unknown that medical science is trying to. So sometimes I think it's also important for you to know that someone can be infertile, but it's not his or her fault. Yeah. So you need to try as much as you can to understand with the person.
When you want to talk about the unknown, I know what will come into people's head is village people. What?
Okay. Village people have suffered. Village people have suffered a lot.
So most people actually term that unknown for village people.
Okay.
So something we can't.
Yeah. So for people who believe in the spirituality of life and the rest, which even medical science also condone to it, although medical science stops at the empirical aspect of it. It's quite possible. It could even be spiritual. It is, but medical science will not tell you that. It has to be the unknown. So thank you so much, Deborah Eka. So just give us, your last words on infertility. What do you tell people out there when it comes to infertility? What should they know?
Okay, this will just be like a little bit of summary. Okay, just as I've said, from the men should try to don't cook the balls, and the ladies try to avoid those alcohol, smoking. And if you notice that you're having infection, like you notice that it be painful urination, you're having itching around there, please carry yourself to the hospital. It's better to know the root cause of the problem, and then you treat from there than treating just the surface.
All right. So I think it's important. Thank you for pointing that out, because some people don't realize that there's what we call PID, pelvic inflammatory disease, where a disease that maybe affected your vagina could do an upward movement towards other reproductive organs like the womb and the cervix and the fallopian tube, and then becomes a problem. So like you heard our guests say, it's essential as men that you preserve your balls. Your balls, there's a reason they call it balls. It gives you balls because it's where your testosterone is synthesized. Testosterone is what makes you a man. Testosterone is what, it's what differentiated you from a woman when you got to puberty, and it's produced by your balls. So keep your balls okay. It's going to help your reproduction. It's going to help your manliness, in quote. And for ladies and also for men, please, when you have an infection, go get yourself always sorted out. And it's important that infertility is not something you should give to yourself. It's something that you should go to a medical personnel and get yourself assessed. And don't forget that before you say you're infertile, you need to try regularly, try without protection for like 12 months. And by then you can say that you're infertile. And if you're infertile, there are things that can be done to help you. Can be given drugs, your fertility can be boosted, and there are other assisted reproductive technologies that can be used. So that is why here at the Intimate Matters podcast, we tell you that we are going to take you on a deep dive into the world of sexual and reproductive health, and we teach you the things that you may know. If it's the things you know, we teach you better. If it's what you don't know, we bring it to your knowledge. And we want to say thank you so much for always sticking with us, and do well to engage with us on all our social media platforms. And if you're on the private community, you can drop your comment. You can make sure you suggest topics, if whatsoever that you would like us to talk about, and we'll be glad to oblige you and to discuss your topic. Today we were with the very amazing Deborah Eka, and we're glad that she shared with us the knowledge she has about infertility. Thank you for joining us on the Intimate Matters podcast. My name is Nurse Akwa Wakman, and in the Intimate Matters podcast, we say and we believe that your intimacy matters. That's why we talk about it. Thank you.